After your lumbar operation, we want to make sure that you are recovering at a very gradual pace. I know that many people recover at a different pace, and some people feel amazing and great immediately after. However, some do actually take a little bit of time for that nerve to bounce back. As we're getting back at it, we want to make sure that you are increasing walking. We do still need to limit the bending, lifting, and twisting for your lumbar spine, and so make sure that you are careful with that. After your operation, there are several reasons that you would want to contact our office. If you do have a fever over 101 degrees, if you have any redness, swelling, discharge from the incision site, any difficulty with bowel movements, urinating, or if you have any problems with being unable to swallow, we definitely want to know about that. Please call my office at 512-314-3888. We have an on-call number, and they will get a hold of me 24 hours a day. So I'm more than happy to answer any of the questions that you may have during this time. One of the things that we want to make sure that you do is also keep the area as clean as possible. One of the things that you can do is actually remove that bandage 3 days after your operation. However, we want to keep the steri strips that are underneath there intact and on the skin for at least 7 days. You may shower after day 3, but no bathing for at least 2 weeks. After your operation, we also want you to avoid several things. Please no taking any NSAID medications, including ibuprofen or naproxen or Aleve. These can sometimes increase the chance and risk of bleeding. That also includes things like aspirin and other blood thinners. If you are taking them for any sort of a cardiac issue, please let us know and we can specify how you can return to those medications. Another thing we want you to avoid for at least a week after your operation is driving. Just please don't do that. And also, we want to make sure that you're not on the road while you're taking any sort of pain medication. So that's sort of our reasoning behind that. After the operation, we want to make sure that we are restricting some of your activity level. We want to make sure that we are increasing these gradually and over time. However, we want to avoid lots of pulling and pushing activities, including lawn mowers or heavy equipment like lawn equipment. Some people also will need to avoid any sort of like dog walking. This can create a lot of that pulling motion that we want to try to avoid at this time. You may actually restart any sort of sexual activity, usually around the 2 to 3 week mark. You'll probably need to take more of a passive role at that time though. Also, with getting started and getting more active, we want to be careful with that lifting. So we actually like to restrict patients lifting to about 5 to 10 pounds as you're recovering. This can increase after the 4-week mark, where we'll be able to increase that by about 5 to 10 pounds per week until you're up to where you want to be.